Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on ankylosed tooth root. So patient had basically come with a chief complaint of pain in the lower left side. So the patient was referred by some other dentist where the extraction of tooth had been performed without the CBCT or without the dental X-ray. The coronal part of the tooth was extracted, but the radicular part of the tooth was left behind. So some other dentist had referred for the scan. So as we can see this is the extracted portion, the leftover portion of the tooth root. The root seems to be ankylosed to the cortices. So you can see this is the mesial root. The mesial root is curved as seen in the sagittal cross section. This is the sagittal cross section. We can see this is the mesial root which is curved, and this is the distal root. This is the distal root which appears to be straight, and both the roots seems to, especially the distal root, seems to compress the nerve lingually on the lingual aspect. This is the nerve canal cortex, so we'll just mark it over here. This is the nerve canal cortex. We'll just mark this thing. Okay, so the nerve canal cortex is here, and we can see the nerve is in contact with the root. So uh, extraction of the root piece can also lead to paresthesia, and hence the symptoms needs to be explained to the patient as well. You can see as seen in the sagittal cross section. Similarly, you can see this in the axial cross section also. So these are the burr marks which are seen. This is on the mesial aspect and on the distal aspect. So the tooth was sectioned into pieces, and you can see the same in the 3D volume as well from different angulations. Okay, so we'll just remove the nerve canal, and we'll just study the 3D volume. There's the top view of the 3D volume. We'll just study the side portion of the 3D volume. So here's the side portion of the 3D volume. We'll just remove the cortices. So the buccal cortex has been removed, and there is the root anatomy that is seen. So we can also appreciate the burr marks that are seen, and the nerve canal cortex as well. Okay, we can see how lingually the nerve canal is being compressed. Okay, so and also then we can study the same thing in the cross section photos also. Okay, so this is the thing. There's the mesial root, the curved mesial root, nerve and root contact, and the distal root which is placed buccally. Okay, so this was all about ankylosed tooth root, which was causing pain to the patient after extraction. Okay, thank you so much.